Ladies and gentlemen, please join together to welcome to the stage Duke University School of Medicine, Dean Mary Klopman.
Good evening, everybody, and welcome. What a thrilling opportunity to thank all of you for your support for our scholarship and fellowship programs. Your impact is hard to measure because it goes over many generations. Tonight, we're also going to celebrate the students that you've supported. Their stories are just amazing, and I hope you have the opportunity at your tables to really listen to their stories, because I think you'll start to get a sense of how important your support is to Duke. We are in a very competitive environment. We know that it is a mandate of Duke's at Duke University to train the very best students, and to do that, we need to be able to recruit them here. Part of recruitment is being able to offer them the support that they need to pursue their careers. We're very proud of the fact that Duke, as a private school, has some of the lowest debt in terms of the graduating students. But to do that, obviously, we need to be able to offer them support. And in fact, 86% of our students are offered some form of support. Again, something that we are incredibly proud of. It is our mission to continue to be able to train the very best and to attract the very best to Duke. Now, Duke is not only about people, it's about buildings. And as you can see, I am standing in front of the rendering of our newest building. This building, if you go down Trent Drive, is right next to the nursing school. What's very... Who is that? What's very important about this building is it also represents an initiative. And that initiative is to really train the future healthcare professionals to learn how to practice in an environment where there are multiple professionals in multiple areas of medicine. So it's really interprofessional training. So in this building is going to be the first permanent home. We claimed it as the first home for our doctor of physical therapy, but I was told for a while it was in the Bell building, so the history may not be correct there. Certainly some of our nursing students, this is an extension of the School of Nursing, but also members of the Department of Orthopedics. So it really is interprofessional and really is a symbol for our commitment to interprofessional training. So we know at Duke Health that there are many benefits to having the top training programs. One of those benefits is they become our future workforce. I've always been astonished by the fact that 60% of our practitioners here at Duke did one part of their training either as an undergrad, a medical student, a resident, a fellow at Duke. And in fact, I'm a quadruple Dookie. And I constantly tell my colleagues, this is our workforce development. So one of our stories tonight is going to be the story of a very successful faculty member. I call him Kaf. Kaf Zarasi. Oh, Kaf, I always get your name wrong. Well, Kaf is a member of the psychiatry department and is an amazing physician scientist. But he's also a graduate of University of Maryland, Baltimore County. And he was very instrumental in the recruitment of a student that you're going to hear his story. And that student is Dalton Hughes. And so I welcome Dalton.
So there are certain events that will happen that will take you by storm and grip you for the rest of your life. I can imagine that many of you have these life-altering events that happen that will either propel you into new endeavors or even let it wash over you in awe as you reevaluate what your role in this world would be next. My name is Dalton Hughes. I'm a fourth-year MD PhD student here at Duke, and I'm in my second year of my graduate studies in the Department of Neurobiology. I'm the kid back in the day that was just in love with science. The type that would ask so many questions until teachers would say, all right, calm down, we'll talk after class. The thing is that when I came to medical school, I had that inquisitive nature about myself, along with this ability to just be excited about anything that I wanted to do. And so during my second year of medical school, after every single one of my rotations, I would call my mom and say, hey, Mom, I'm about to be a surgeon. 1 month later, Mom, don't worry about it. I'm going to be an anesthesiologist. And then lastly, at the end of the year, I was like, forget everything I ever told you. Don't even worry about it. I'm going to be a pediatrician. I'm going to save some kids. But what's interesting is that I thought that all of those events during my second year were the ones that were going to define who I am going to be next. And it wasn't until later on at the end of my second year when I went home and I ran into an old friend named Rico who was just returned on his second tour from Afghanistan. The tough thing about that is that just like a lot of the veterans that return from war is that he was diagnosed with post-traumatic stress disorder, or PTSD. I remember just seeing him and just laying eyes on him, I can realize that there was just something a little bit different. There was something missing about him just by looking in his eyes. And I can recall holding his little girl while I talked to his wife about how she's having difficulties just making connections with him at this time. Fast forward another month or so, I get a call from my sister, and she was just involved in an altercation at the hospital where she worked. She's a VA nurse in the psychiatric ward. And the tough thing about that is that a patient just had a fit of anger and attacked her. She was hospitalized, she took her pain medication, she did her therapy, and afterwards, when she returned to work, she had to hold two huge weights. On one side, she had difficulties expressing that compassion that she had for her patients, and on the other hand is that she just no longer felt safe in the place that she worked, in a place of healing. The field of psychiatry is both a science and an art. And as a student, being able to watch psychiatrists do what they do, I'm in awe about the magic of sitting down with the patient and formulating treatment plans. However, as a friend, a family member, and as a future scientist, I'm disappointed. These things are difficult to treat, and having that subjective nature has brought us to a beautiful point in science where we can actually ask questions and probe and see what's going on within the brain. And I'm charged to find out what is the quantitative and the more objective ways of finding out what is going on with patients that are dealing with psychiatric disorders. To take a little bit and give peace of mind to my patients and even to their family members is something that you can't put a price on. Later on, I realized that I'm excited about this, that I'm up at 4 o'clock in the morning interested in answering these questions, and I'm charged, and I'm online just trying to figure out what can I do, how can I be involved in answering these questions. So when I entered graduate school, I was luckily awarded the Wakeman Fellowship, which allowed for me to have some funds to join a lab and to ask questions that I'm interested in and not be a financial burden to the lab. So I found a lab that just was in line with exactly what I wanted to do and to find ways to lay the foundation that we can find new ways of diagnosis and treatment of these disorders. Because simply, I don't want to live in a world where you can take my loved ones away from me, take pieces from their personality or the way they interact with each other, and then replace them and give them back to me, and you don't tell me what the hell happened to them. We have to answer those questions. And so as I'm up again at 4 o'clock in the morning, now analyzing data sets and trying to make sense of what I'm doing in the lab, uncaffeinated, I'm interested and I'm enjoying it and I'm loving exactly what I'm doing because I'm aligning not only a question base that is important to me and important to my family members and those that I interact with on a daily basis, but also it allows for me to do exactly what I love to do, and that's play on that playground that I call science. And what I have here is passion. So for those of you that have made support and have made that stake in finding out students that will identify that passion and allow for them to pursue that passion, I graciously and unwaveringly thank you for what you do. Thank you.
As I've taken some time to reflect upon the journey that I have taken to the physical therapy program here at Duke, a common phrase continues to come to my mind. That phrase is defying the odds. One aspect of my life where I feel I have defied the odds was in becoming a successful Division I track athlete. However, many people around me might say that I was destined to become a track athlete for several different reasons. First of all, both my dad and my grandpa ran track in college. I began running personally when I was only in the 4th grade. And lastly, but probably the reason most people believe I was destined to become a track athlete is because, well, my name is Track. So anyway, as I was mentioning, I feel that I defied the odds. So I want to tell you guys a little bit about how I feel I defied the odds in this aspect. I grew up in an extremely small town in southern Utah and graduated from a class of only 20 students. Because of this, I found it extremely difficult to get recruited by the big universities, even though the times that I was running were very comparable to the people I was running against from bigger schools. However, eventually, with a lot of hard work and a lot of dedication, I was able to sign a letter of intent to run for Utah Valley University, a Division I school. While I was there, I had a lot of success, and eventually I even ended up qualifying for the final rounds of nationals and representing my school. Now, like most athletes, I suffered a lot of different injuries along the way, so I had the amazing opportunity to work with some great physical therapists. It was during that time of my life that I realized the impact that a great physical therapist can have on one's individual life. Now, I've talked a little bit about a few ways that I feel I have defied the odds. However, I feel the people that are really defying the odds are the patients that we work with on a daily basis. When I was an undergrad, I had the opportunity to volunteer at a physical therapy clinic for neurologically disabled children. I specifically remember there was a set of 8-year-old twins who came into that clinic. As they came in, I realized they couldn't walk by themselves. I also realized they were unable to verbally communicate. And on top of both of those things, they were also completely blind. During one of our treatments, we sat one of the boys down at a bench and placed a piano in front of him, as his parents told us that he loved music. He then began to play the piano. At that point in my life, I had played the piano for 8 years, and to be honest with you, I thought I was pretty decent at it. However, this kid began to play the piano, and to tell you the honest truth, he was way better than I was. Now, in my opinion, this young boy is a perfect example of someone who is defying the odds. Because of this experience and many others very similar to it, I knew I wanted to attend a program that would be able to prepare me properly to one day in the future become a physical therapist that could maximally influence the lives of my patients. As I found myself here interviewing at Duke, I had already previously interviewed at a couple different schools. However, within the first hour or two of being here, I knew that this was the place for me. There are a few things that set Duke apart from the other schools. One of those was the emphasis that is placed on group-based learning in our program. Another one, and what was probably most important to me, was with each of my interactions with the different faculty, I could sincerely tell that they cared about the success of their students, not only in the classroom, but as we went out into the future and became professionals and clinicians. I'm extremely grateful as well for each of you and the contributions that you've made to our great programs. I know that with the help of you guys, you have made it possible for me and other students to defy the odds. However, more importantly, you've made it possible for us one day to go out as professionals and help our patients defy the odds and accomplish their goals. Once again, thank you.
All right, so I know we're about to eat, but for the next few minutes, we're going to talk about everyone's favorite dinner topic, colonoscopies. This is because right now, colonoscopies are the best method we have to prevent colon cancer. And as a common screening test, I think we may be able to get rid of them. My name is Brian Sullivan. I'm a second-year gastroenterology fellow, and my research is being funded by the Killenberg-McLeod Scholarship. I always knew I wanted to go into medicine. My father's a physician doing research on aging, and my mother's a nurse practitioner in a sleep clinic. But it wasn't until college that I knew I wanted to go into medicine to prevent colon cancer. While I was in college, my grandmother was diagnosed with this disease. At that time, I learned how truly devastating this problem is. My grandmother experienced unimaginable suffering that I had never seen before. And unfortunately, this is not uncommon. Colon cancer is the second leading cause of cancer death in America, with a lifetime risk of about 5% in those who aren't screened. And unfortunately, we can't predict whether you will or will not develop colon cancer. And so that's the first problem we're trying to tackle here at Duke. I want to know whether you're in that 5% or in the other 95%. Because if you're in that 95%, maybe you don't need a screening colonoscopy. But until we figure out which group you're in, please continue getting screened. But here's the other thing. Even if we can more accurately determine who should and should not get screened, we need to make sure these tests work. My grandmother understood the power of colonoscopy. She was getting this test every 3 years, but her cancer was missed. And so we're trying to figure out why that happens and how we can prevent that from happening in the future. So colonoscopy is not a perfect test, but it's the best test that we have. And listen, I get it. They're also not fun. They're invasive. You have to drink the bowel prep and deal with that joy all night. And even with the medicines, the good stuff, as some of my patients would say, they can be uncomfortable. I'm not going to ask you to raise your hand if you've missed your most recent test. But based on my experience, I think a lot of you have. But that's a problem, because most new cancer diagnoses are in those who are not getting screened. And so maybe the answer is we need a different test, one that everyone is willing to get. And that's the future, a better test that is easy to get and that everybody wants. And so that's the final part of our research. We're trying to unlock the genetic secrets of colon cancer, because I think this research will lead to the development of more reliable, non-invasive testing that is easy to do and that everyone will willingly accept. Now look, I know that's a big goal, but that's why I came to Duke. My mentors understand my experiences and believe in my passion, and they're helping me positively impact our world. So I hope it's clear why I'm here tonight. My family is my drive. Our community is my drive. And together with the partnership and support of everyone in this room for educational funds like the Killenberg-McLeod Scholarship, I think we can potentially create a future where colon cancer, and maybe even screening colonoscopies, are not an issue. But listen, until that day, I encourage everybody to keep getting screened. Despite what happened to my grandmother, colonoscopies have an excellent track record, and we're getting better at them every day. So please, call us for your appointment, keep drinking those bowel preps, and I'll see you in the colonoscopy room.
Ladies and gentlemen, please welcome to the stage Duke University School of Nursing student, Chris Frei.
There are many reasons why I became a nurse. The excitement, the trauma, the hands-on clinical experience, the blood, the guts, the gunshot wounds. But after several months on the cardiothoracic intensive care unit here at Duke, I quickly realized there was much more to this noble profession. It's those actual, personal connections you make with your patients and their families. It's those 1 minute, 2 minute, truly human interactions that are priceless. The job is tough, and those moments don't happen every shift. Heck, they don't even happen every week. But when they do, they are unforgettable. I'd like to share one of them with you guys so I can help you understand what you're enabling for people like me. I was taking care of a 65-year-old gentleman, we'll call him James, who had been the recipient of a heart transplant the day prior. It was my shift where he'd be taking his breathing tube out and waking him up for the first time. It was a hectic day shift where I was managing 2 patients, their respective families, and all the monitoring and tasks that go along with being a nurse. James was groggy, but becoming more himself throughout the shift. His family had been with him the entire time, but not more than 2 minutes after they'd left the room for dinner, his call bell went off. I walked into James's room and I asked what I could do. "It's been such a surreal day," he said. "Can we just make it a little more peaceful in here?" So I shut off the bright fluorescent lights, I muted the TV, and I closed the curtains. I began to walk out the door when I asked James if there was anything else I could do. He said, "Actually, Chris, there is one last thing." And he asked me to sit next to him. So I took the seat next to him where his wife had been, and he put out his hand for me to hold. I said, "What can I do?" And he looked at me and just said, with a smile, "Nothing. Nothing at all. I'd just like to sit here with you and listen to my new heart beat for the first time." I know. And it's people like you that make moments like that possible, not just for the nurse like me, but for the patient like James. And it's moments like those that propelled me into nurse anesthesia. To me, the best part about becoming a nurse anesthetist is being able to make those quick, true connections with your patients and their families. Preoperatively, we only have 10 minutes to build trust and compassion. Intraoperatively, we have the privilege and honor to be the advocate for the patient while they're unconscious. And postoperatively, we have the privilege to wake them up and let them know that they're okay. You know, I wasn't even supposed to be here tonight. The plan was for me to continue working at the bedside while my lovely fiance, who's here with me tonight, We're getting married in September. So, yeah. The plan was for me to keep working at the bedside while she finished her degree in nurse anesthesia here at Duke. Between tuition between the both of us, we just couldn't afford to go at the same time. It's because of you that Brittany and I are here tonight as classmates. The Nurse Faculty Wives Scholarship made that possible. So for all the moments you've given us, and for all the moments you will give us, we thank you.
I was born a nerd. At age 3, I remember having my first appointment with my pediatrician, Dr. Jose, and I remember looking at her and thinking, I want to do what she does. My name is Melanie Rogers, and I'm a first-year student in the Duke Physician Assistant Program. At a young age, I was placed in the foster care system and was raised alongside 27 different foster siblings throughout my childhood. I feel very grateful for the people in my life that have played a pivotal role in me standing here today. Linda, my foster mother, who's here with us tonight, who helped embrace my inner nerdness and and supported all of my odd habits. For example, studying in the bathroom where there was white noise at times when the house was noisy. Dr. Jose, my pediatrician as a kid, who was my first ever role model in the healthcare field, and Maria, my Peruvian nanny, who helped raise us foster kids and is the reason that I'm bilingual. Growing up in foster care, I began to recognize that there was a very common theme and a very common mentality that we all had. And that was, because of our circumstances, we deep down believed that we would not amount to anything greater than what our parents were. Why would we? Our parents are addicts, abusers, alcoholics, beggars. Why should we amount to greater than that? And I spent my entire childhood and adulthood fighting that feeling. So taking my goal forward, I began to seek out opportunities in which I could get my feet wet in the healthcare profession. So I used my Spanish language skills to serve as interpreters for providers, both locally and in Washington, D.C. I served at multiple clinics in the city where I served the uninsured, and also in the Dominican Republic annually as part of my undergraduate career, where I helped build a clinic down there in the community. After college, I became very determined to have a wide understanding of all the different healthcare roles. So I shadowed nurses at the NIH, PAs, NPs, physicians, until I finally found the role that was right for me. As a PA, I would encompass who I am as an individual, which is very well-rounded, and the way that I saw it, a PA was the jack of all trades. So fast forwarding, I applied to 6 schools that summer, and on November 16th, around 4 p.m., I got into Duke. And just a few months later, I was here in Durham, ready to start my first class. Now, prior to PA school, I sought out opportunities in which I could serve as a mentor for children in the foster care system. So I volunteered at these community events that I too had to attend while I was in foster care, where we were taught basic life skills. So how do you apply to college? How do you do your taxes? How do you study for that standardized test when you don't have a parent that's going to pay $2,000 for that course so that you can do well? And I remember at one of these events, a 10-year-old girl coming up to me, and she was super excited and tapped me on the shoulder, and she said, "So you mean if I want to go into medicine, you mean I can do that?" And I told her, absolutely. So fast forwarding, my scholarship here at Duke has enabled me to serve as a mentor for students in the undergraduate program who have a similar circumstance who are also pursuing a career in medicine. If I've learned anything, it's that a girl that grows up in a single-parent household with 27 foster siblings, she does not get to Duke on her own. She gets here through the help of people, right? Linda, Dr. Jose, Maria, every single person in this room. Yeah. Because of my scholarship, I will be able to serve as a link between students that might just need that little bit of extra guidance or mentorship to push their career forward. And Duke, you have made that possible for me. Thank you.
It was the 2012 Olympic trials, and I was one dive away from my first Olympic team. I was leading, but the second place team was closing in pretty quickly, and I knew I needed a nearly perfect dive in order to make the team. So as I stood backwards for my last dive, I did what I always do, took a deep breath, and told myself, "You've got this." My team and I scored 9s and qualified for the Olympics by 4/10 of a point. My name's Abby Johnston McGrath. Thank you. My name's Abby Johnston McGrath, and I'm a fourth-year medical student. So the London Olympics played out like a fairy tale for me. I was able to stand on the podium, watch my country's flag rise up as I put a silver medal around my neck. I met athletes from across the globe who were just inspiring, and at the end of this, I was like, I have to do this again. This was amazing, and I only want to go back to another Olympics. But I also had dreams of becoming a doctor, and I felt that the two conflicted with each other, and the possibility of training for the Olympics would mean putting my medical career on hold. But as luck would have it, I was sitting at the McDonald's in the Olympic Village next to a girl in a USA sweatshirt, and we got to talking. She told me she was a rower, she was from Boston, and she was in medical school. And that was a light bulb moment for me, and I realized that I could pursue both. I could go to medical school, and I could also train for the Olympics, and that they weren't mutually exclusive. And at that point, I decided to go for both. And as I was deciding where to go for medical school, it was between Duke and UNC, and we all know which blue is best. So apart from the superior color, I also knew that Duke was a type of place where I would be supported and encouraged to pursue what I wanted in the classroom and also in the pool. I knew that the administration was encouraging me to change the curriculum in order to accommodate my competition schedule, and also that the scholarship that I was given would make tuition financially viable for me and also give me money to train and compete and have living expenses paid for. So I competed throughout my first and second year of medical school. I earned the honor of competing for the 2016 Olympics in Rio, where I ended my diving career, and that all wouldn't have been possible if it weren't for the scholarships that I received and the money that I had from Duke in order to pursue that path. Because shockingly, there aren't huge NBA-sized bonuses and endorsement contracts for diving. Nobody wants you to wear their Nike shoes, so I had to rely on my brain in medical school in order to get there. And as bittersweet as it was to close that chapter of my life and end my diving career, I couldn't have been more excited to come back and know that I was going back to medical school and taking that next step in my career and entering a lifelong career of becoming a doctor. So I'm happy to say that I'm staying at Duke for another 3 years of residency in emergency medicine. Thank you. You can't get rid of me yet. Duke, I'm staying here forever, I hope. And I really wouldn't have made it this far in my career. I wouldn't have been on the podium. I wouldn't be wearing a white coat if it weren't for the support and the help of people like you who are very generous. And I want to thank you for all that you've done to help me to get to that point.
I did not know that I would be a Duke graduate or that I would even continue school beyond my high school education. My parents didn't value or encourage advanced education. My father dropped out of school after 4th grade. My mother struggled to get a 2-year associate's degree. Financial resources were scarce in our home, but she did provide the necessities. She was a leader. She did teach my brother and I hard work, dedication, and perseverance were the key attributes to success. My name is Samantha Casper. I'm an adult nurse practitioner student at Duke University in the primary care setting. I did not complete high school. I did get my GED. And from there, I still wanted more, so I continued prerequisites. Interested in the radiology program at the time. I was working as a cashier in the evening in a factory. I was working cleaning houses during the day, so I was taking 1 class per semester. 2 weeks before my 19th birthday, I was in a car accident. I was headed out for a night of fun with a friend, and I was a passenger. My mother got the phone call. When she arrived at the hospital, she was told that I was not expected to survive because I had suffered a traumatic brain injury. 1 week later, I was told that I could never go back to college from short-term memory loss. And still, my mother instilled into me, do more, be more, don't give up. So 2 months later, I re-enrolled in college, but at that time, it was for the nursing program. After I completed my associate degree in 2006, I took 6 years and finally went back, eager to advance my education, and went for the RN to BSN program. Took a short break, thought I wanted to do administration, so I went to get my MBA with Health Services concentration, graduated with President's Honors. I knew quickly that this degree took me away from the whole reason I became a nurse, and that's the patient. That's the interaction with them and their family and caring for them. I saw a friend of mine and colleague post on Facebook that she had been accepted into the nurse practitioner program at Duke University. And I thought, that's just 2 hours from my home. I can do that. Let me check into that. So I did. I knew she was a mother. She worked full-time still as a staff nurse. She was married, and my life closely resembled that. So I started searching opportunities at Duke. I was immediately intrigued by the mission, the core values, their collaboration with the Veterans Healthcare Administration, the research, their rankings and accolades, and I said, I want to be a part of this. I applied. I had my interview. Within 2 months, I was starting the nurse practitioner program. That was January of 2016, while still working full-time. Duke was ready for me. I don't think I was ready at the time, but they have ensured that I had everything I needed to be successful and to this point. So I want to say thank you for your donations for scholarships. My mother would be proud of me. I have 2 girls. I am setting an example for them to do more, to excel in life and be more. And even though my mother's not here today, she will be here with me in spirit when I graduate on Mother's Day, May 13th of this year. Her health failed. Thank you. Her health failed 2 months ago and she passed away. So I know she would still be proud of me because she was and told me all the time. And she'll be with me in spirit just as you all will also. So thank you.
Good evening. I'm Marion Broome, and I'm the Dean of the School of Nursing at Duke University. You know, we have a lot of events here at Duke, especially this time of year. This is my absolute favorite. And I know you've been moved by many of our students who've spoken tonight. Their dedication, their hard work, their dreams, and none of those would have been possible, as so many of them said, without your generosity. As a first-generation, myself, college student, I know so incredibly well how important a scholarship is. I was a baccalaureate student at the Medical College of Georgia, and I would not have been able to do that without scholarship support. And as I think of our nursing students who come back to obtain graduate degrees, they're working, they're parents, they have very busy lives. They also have debt from their first degree and sometimes their second degree. And yet they have a dream and they're going to reach it. And we have a major commitment at the School of Nursing so that we will scholarship every student who needs it. And we could not possibly do that without so many people in this room to make their lives just a little bit easier. The programs are very rigorous. It takes a lot of time. And all of them have told me how important those scholarships are to just ease their anxiety and allow them to focus. They sometimes cut back a little bit on work, and then they focus on their studies more. So what I've heard tonight, is the future of healthcare. Our students at Duke, they're actually going to do fantastic things. They're going to cure some diseases. They are going to stop some illnesses that we think right now are not stoppable. They're going to lead major health systems, but they're also going to do some incredibly important things as well. They're going to hold the patient's hand. They're going to witness the struggle from birth until death for the patients that they care for. They will do research together in labs as well as in the community. But none of that would be possible without the spirit of generosity that those of you in this room have. Those of you who believe in our students and believe especially in our Duke students who will make the world a better place, without a doubt. I can't think of a better investment, personally. So I want to thank, again, let me ask the students that are here. We have students that didn't even present. All of you stand up one more time. So remember, when you're looking at them, you're looking at the future of healthcare. Thank you very much for spending the night with us. I hope you were as inspired as Mary and I were, and we really appreciate you taking the time to spend an evening here again in the spring with us at Duke. Thank you.